everyone, it's Jackie and Renee here again at Shift Physical Therapy and Wellness. Welcome to our page. Maybe you found us from Facebook or maybe you are just visiting and perusing our website. But this section is all about videos that we make with hard to talk about topics and or topics that we can openly not be censored and use whatever words that we want to use. So today, the video that we are doing is really trying to provide some education about the anatomy of the pelvic floor. We're going to be utilizing the female pelvic floor model here today.
Yeah, so the first thing we're going to talk about with the pelvic floor is kind of the 5 main functions of the pelvic floor. So what we've got here is the hip bones, if you kind of feel those bones on the side. And then if you come down on the bottom, this is our sit bones. So the ones, if you're sitting in a chair, you can feel those bones sitting against the chair. So right between those sit bones is really what we're talking about in terms of pelvic floor. And that's a very broad term. We'll get into that in a minute. But the 5 main functions of the pelvic floor, we call them the 5 S's. So the first is support. So the pelvic floor here at the base really provides support for the internal organs. So we're talking about the uterus, we're talking about the bladder, the rectum, etc. So that's one of the first primary functions. The second being sphincteric. So basically talking about closure. So closure helps with continence, so being able to control any involuntary loss of urine or feces, but it actually provides that sphincteric control for the urethra, the vagina, and the anus.
So we're looking at these areas here. So she's talking about the closure through here and the sphincteric or the sphincters that help us with that control.
And then the third S would be sexual function. So the pelvic floor plays a very important role by, number one, it has to be able to relax and allow penetration to occur, but then also the contracting portion during orgasm. The fourth S is for stability. So if we look at the pelvic floor by itself, we don't really necessarily understand this, but when you put in the diaphragm, our breathing diaphragm just below the lungs, our abdominal wall, and our back muscles, we really kind of create this big system that helps with stability of the trunk during movement. So the pelvic floor plays a really important role in controlling movement of the trunk and allowing that force transfer into our legs. And then the fifth S, or the fifth function of the pelvic floor, is to be a sump pump. And so what that means is there's a lot of vessels and a lot of lymphatic system that goes right through this area. And so it plays an important role in helping with that drainage or getting the circulatory system and the lymphatic system to get fluid to and from and out of our lower extremities and back up to the heart.
All right. So when we're looking at the pelvic floor, there are 3 layers of pelvic floor muscles. We're not going to go into all of the muscles that are in the pelvic floor. We can talk about that when you're here. We'll go through that, okay? But there are 3 layers, and each layer of the pelvic floor can be assessed during an internal examination.
So during that internal examination, basically we would use one gloved finger and insert it first to the first knuckle for layer 1, second knuckle for layer 2, and third knuckle for layer 3. And within each of those layers, we're assessing multiple muscles. And so when we talk about the pelvic floor, we're not just talking about one muscle. We're talking about 12 plus muscles, of which maybe 1 or more can be weak or tight or causing some sort of dysfunction that can lead to problems in any of those 5 S's that we just talked about. So maybe it's problems with sexual function, maybe it's problems with sphincteric control or continence, maybe it's support of the organs. Maybe we're seeing some prolapse happening where actually some of the contents from the abdominal wall are pushing down and we're starting to see things maybe bulging where they shouldn't be bulging. That can be from the rectum, that can be from the uterus, that can be from the bladder.
Many women describe it and they will say, it feels like my vagina is going to fall out, or it feels like my uterus is falling out. And so it is a very real thing that can occur for women that affects the pelvic floor.
And they oftentimes describe a great deal of pressure in the perineum, or that kind of area between the sit bones. And so being able to talk about these things with a pelvic floor physical therapist, and having a pelvic floor physical therapist assess each of those layers of muscle and assess what's happening to the pelvic floor, can really provide a lot of solutions and answers to the issues that you've been having.
And having that good understanding of the anatomy of what our bodies have helps to put all the pieces of the puzzles together, because you might be someone who is experiencing low back pain and have tried the chiropractor and tried physical therapy and gone through the works, but there is a missing component here of the pelvic floor. So it's important to understand how everything works together, right? So we want to address those things as well. Individuals who might see us specifically for pelvic floor therapy, it doesn't always have to be that they're leaking urine. Like I said, it could be low back pain, it could be hip pain, tailbone pain, pain with sex. There's that incontinence piece. It could be women who have had C-sections and have some over abdominal scarring that has occurred that's affecting the pelvic floor. And not everyone that comes to see us needs to have an internal pelvic floor assessment, but we'll work through that with you to determine if that's the appropriate treatment plan to assess what's going on in the pelvic floor.
Thanks for joining us on our talk about anatomy and physiology of the pelvis.
All right, you guys have a great day.